Next disease condition of the upper respiratory tract could be the acute laryngitis. And when they say something is acute, they simply mean the thing is just starting all of a sudden. Okay, the thing is starting all of a sudden, and the symptoms are just going crazy, going crazy like that. Okay, so acute laryngitis. And I also told you guys that anytime you see itis, that means there's inflammation, right? They are talking about the larynx. Okay, so inflammation of the larynx is what is known as what acute laryngitis. So see, inflammation of the larynx. Okay, so we'll talk about this disease condition from the definition. We'll talk about the causes, talk about the symptoms. That's if there's inflammation of the larynx, how will the patient present? We'll talk about the diagnosis. We'll talk about the treatment options. We'll talk about the complications. We'll talk about the preventions. All right, and that will be all. Okay, so for the acute laryngitis, we say that it is an inflammation of the larynx. And what is the larynx? The larynx is the voice box that has the vocal cords. Okay, through vocal cords, false vocal cords. So this is where your voice is formed. That's why they call it voice box. So of course, the first symptoms is what? If there's inflammation of the larynx, there will be what? Hoarseness of voice or total loss of the voice. Okay. So one thing is that there's inflammation of the larynx that can cause hoarseness and loss of voice, and also there will be breathing difficulties. Okay. And talking about the most common causes for this condition, it could be viral infections like common cold and flu. It could be bacterial infections like what streptococcus. It could be overuse or misuse of the voice. Like me today, I'm recording just 60 YouTube videos. Once I record 60, that's all. And I won't record for like 2 days. Okay. I don't want to misuse my larynx before I start having some problems. Okay. It could be due to some irritants like smoke or chemicals. Okay. Then it could be due to some allergies. You just don't really like something, maybe a smell or something, maybe a perfume, maybe a flower. Okay. So it can cause an inflammation of the larynx. So talking about the symptoms, we have already spoken about it from the definition, but let's just repeat. So there's hoarseness or loss of voice. There's a sore throat. There's coughing. Person will be coughing. Right? Difficulties breathing. There'll be fever and there'll be fatigue. Person will be weak. Diagnosis. You could do a physical examination. Then because the larynx could be down there, you might just want to do what? A laryngoscopy. Okay? Which is just visual inspection of the larynx. Okay? Then you could also want to do a throat swab. So a throat swab is for what? Bacterial cultures. So you just want to get a swab so that you can test in the lab to see if this condition is being caused by some microorganisms like some bacteria and stuff like that. And treatment, if you are misusing the voice, you might just want to rest the voice, stay hydrated, warm compressions, humidifiers, antibiotics, that's if it's a bacterial infection. Then pain relievers if you are feeling pain like what? Acetaminophen. Okay. Then corticosteroids can also be of use. That's for if the inflammation is so severe, right? You might use corticosteroids. Then see inflammation of the larynx. Complications include what? It could result to chronic laryngitis. That's inflammation of the larynx that has been there for over a long time. That's chronic laryngitis. The vocal cord nodules or polyps, then it could lead to respiratory failure. Okay, prevention, since the bulk of the cause is due to infections from microorganisms, and this is mostly due to what? Poor hygiene. So just practice a good hygiene. Avoid loud talking or screaming. That's why I don't make noise. Okay, that's why I don't make noise. I don't like people who make noise. Okay, then stay hydrated, avoid irritants, and manage allergies. Okay, so that's it for acute laryngitis, which is an inflammation of the larynx, also known as the voice box. Okay, the causes, symptoms, diagnosis, treatment are the important areas we touched.